Hello, everyone. Welcome to the Center of Excellence for Infant and Early Childhood Mental Health Consultations Conference, Equity from the Start. My name is Baraya, and I will serve as your session moderator for today. I am joined by Chris, who will serve as our technical host. This session is being recorded. Transcription is available through the Zoom platform, and should you have any questions, please feel free to relay your questions to the chat. We will have time at the end of the session for questions and answers with the presenter. With that said, I'd like to pass it over to our presenters today, Grace Schoessow and Lisa Golden, who will be conducting this workshop.
Hi, good afternoon, everyone, and thank you for joining us in our session today. I am Lisa Golden, coming to you from the state of Ohio, and I am joined with my colleague, Grace Schoessow, and we are presenting Inspiring Equity and Inclusion with Infant and Early Childhood Mental Health Consultation. As I stated, we are from Ohio, and we'd just like to acknowledge our leader, Governor Mike DeWine, and our director, Lori Chris, at the Ohio Department of Mental Health and Addiction Services. I come to you with years of experience in the area of prevention, treatment, and training, and across multiple settings, community-based and clinical areas. And I'm so excited to share a bit of our journey and thinking about how consultation can inspire equity and inclusion. I will turn the microphone over to Grace, who will briefly introduce our topic and workshop objectives.
Yeah, thank you, Lisa. My name is Grace, and I'm coming to you from Greene County in Ohio, which is in the southwest corner. And I'm the director of an infant early childhood mental health program. And I'm also a consultant and have been in the field for a number of years. Our success of our program that we're going to be talking a little bit about has to do with the robust program collaboration that we have going on in Ohio. So we're going to be talking about that, and also with the expertise and the dedication of teams throughout Ohio. My journey, I've been inspired throughout this conference so far to talk a little bit about our own stories and how that informs the work that we do. And my journey and why I'm here talking to you today and why I care so much about inspiring equity and inclusion has to do with my professional journey to this point. I had my own challenging, twice exceptional child. And while I was in grad school in the early 90s, set on being a clinical psychologist to try to solve this mystery of why my grandmother had schizophrenia and understanding how we could prevent those types of major mental health illnesses that profoundly impact families. I had my own call from a childcare provider that my son was struggling and that I needed to come pick him up. And that started me on this journey to try to better understand equity and inclusion. So for me, it's deeply personal and also professional. So we're going to talk today, and we're going to be really diving into a couple objectives that are really important to us. We're going to identify teacher exclusionary practices and disparities that exist that we will be facing and we need to address, and we are the right professionals to be addressing. We're going to explain 2 strategies to employ to reduce expulsion and promote equity and inclusion. And we hope you leave here today feeling inspired to be a champion for inclusion and equity. And we also want to acknowledge that in Ohio that we're having this immense groundswell and overwhelming support for this idea that we can prevent preschool expulsion, and that needs to be a collaborative. It needs to start early. It needs to involve all the stakeholders and partners in having a shared vision. And that is definitely aligned with this idea and the vision that things need to be more equitable, and that we are indeed champions for childhood equity. So we also know that this is very intensely personal, and in that role as a consultant, that we are meeting children that are experiencing these issues in a very personal way, and that the consultants themselves are coming into situations, close contact with children that are struggling. So I want you to consider Grayson. Grayson's risk for expulsion. What's going on with this little guy? So this is a 4-year-old, and he has social skill delays. He has regulation. He has behavioral components. He's acting out in the classroom, times is withdrawing. His teacher is brand new out of a bachelor's degree program for early childhood, and she is new to the classroom. She has an assistant teacher, and she's been in that classroom since 18, right out of a community program, and she loves her job. So the teachers have some expertise, but not both of them. And the parents are frustrated with the program, and they're frustrated that their child is struggling. There's quality rated center in place. So Grayson is at a center that is part of Ohio's Step Up to Quality program, and they are 3-star rated center. So that tells us some information. And there's also a developmental concern. So we know that Grayson's social, emotional, and behavioral needs are they inform what we understand about his development, and they're impacting his ability to be on track developmentally. But otherwise, his language skills are developing appropriately, his motor skills are in place, and his cognitive ability is good. And we know that he is a boy, so that impacts our understanding of his risk for expulsion. And his race is also a factor. His father is Black, African-American, his mother is white, and Grayson is biracial. So we're going to hold this child in mind as we move forward and think about what is going on in a situation where a child is on the line for expulsion from a preschool program. So these are some of the statements that came off of the referral form, and the referral that came in for Grayson, it was through our preschool expulsion hotline in Ohio. We're fortunate enough to have infrastructure that has been built carefully over the past 8 years. And this preschool expulsion hotline brings referrals to local early childhood mental health consultation programs through the Whole Child Matters initiative. And we respond then to those hotline calls. And these are some of the type of information that rolls in when we receive a referral. So for Grayson, the teachers were identifying that he randomly screams and yells, that he resists being touched or comforted. He can be very violent. He gets angry for no reason, appears on edge, has no friends, hurts others on purpose, has a hard time calming down. So these are in the teacher's words on that referral form as it comes to our desk. We'd like for you to hold this in mind as you think about the programming and the response that we are providing for this type of situation, this type of child.
Okay. Thank you, Grace. So as we really do start to consider how those observations and interpretations that the teacher has made about that child's behavior really starts to be paired with a program culture and policies, and think about the impact that makes for children like Grayson, but also his family and others in experiences similar to his. So as we look at these examples, think of the practices that you may have experienced as a consultant in a program, or even some of the experiences that families that you have worked with may have reported to you, and think about how those play out, not just in now, but think about how that plays out in their interactions with the program, interactions in school settings, and later in their educational trajectory. So as we think about these bullet points, we know the relationships with families is critical. And at this point, we can't even say good relationships, because we know that there are some families that are afforded the opportunity to have relationships with teachers and administrators. And we know there are some families that don't even get that opportunity. And research points to challenges with time being a factor and not being able to really interact with parents and the schedule, perceived cultural differences, and not knowing how to quite engage a family that appears different from the teacher that is working with the child and the family. And then there's this idea of family involvement and what that means for programs and administrators, and even for families. And so a misunderstanding of what this might look like and expectation on both sides can also contribute to this challenge when we're looking at interactions and being able to create families develop the relationships with families. When we think about policies, bullets 2 and 3, we know that it's important to think about, even in our early childhood settings, we are starting to have the impact of those zero tolerance policies. We're going to hear a clip from Dr. Gilliam that will highlight just examples of some of those. But when we think about the impact of those zero tolerance policies and other times when we don't have policies that support retention, and we're looking at really removal instead, when the focus is not on retention and prioritize, we create an environment that becomes unwelcoming for children, that results in harsh behavior plans and practices and interacting with families, and creates this place where we've actually essentially start to push families out and gets to some of those soft expulsions that we hear so much about. And so we also think about teacher training and education, just like Grayson's teachers. His teacher had a bachelor's degree and his assistant teacher comes with years of experience. We definitely want to acknowledge the experience, the expertise, the skills that teachers bring into the classroom. And what we know is that just like parents, teachers come with a vision for their classroom, a vision for the children that they're going to serve. And when that vision doesn't quite match up, or there's unexpected challenges, it can be hard for teachers to apply even the knowledge and skills that they do have. And so knowing that sometimes consultation might be a way to support that, but knowing that that is something that becomes a factor in some of these practices that push children and families out of their setting. And of course, we can't talk about exclusionary practice without thinking about the impact of COVID. And so we've created a gap in children being able to access programs. In Ohio, we had many programs that had to close as a result of the pandemic. And so that left families that had very little options for childcare in their communities. And then it left some families with being able to continue on with their work and their day-to-day activities with no disruption. So thinking about some of those activities, experiences day-to-day that parents and families experience, we think about even in the classroom. Beyond just behavior, we know that behavior causes sometimes teachers to have to pull aside certain children and not allow them to participate. But we know this also can be the case with children with different abilities, or children who have difficulties communicating at times. I've been in programs where a teacher will say, well, he likes to be off by himself and he has a hard time communicating with the other kids, so he's fine just kind of being over there in the corner by himself. And so that child is missing out on wonderful opportunities for play and socialization and learning that's critical at this age. There are policies and programs regarding toilet training. And so some programs, there are children who can't progress to the next group setting because they are not toilet trained. And so what does that mean for a child who's developing maybe typically in certain areas, but have some other areas where they're not at the same level as their peers? And so what does that mean for that child who's held back or not allowed to progress with the rest of his group? As we think about children who have different medical or dietary needs, some programs are apprehensive to accept these children because of the perceived burden of time or on staff, and really sometimes the fears that come with caring for a child who might have different abilities or different needs each day. Then these are just a few examples of some of the challenges that are faced by children and families. And I just want to take a moment to pause for you to think about what other types of activities or what other types of practices have you observed in your work with children like Grayson or like others that really do exclude them from daily activities. And as we think about the impact on children, when it's not just one of these experiences each day, when it can be multiple parts of their day, multiple times when these children are experiencing these type of activities or interactions, multiple times over the course of a week or a month that a family's having this type of interaction or lack of interaction with the community that's caring for their child, think about the impact. Really think about what is the impact on these families long-term. And so we need to think about, where does this even come from? And so I'm going to pause just for a moment to give information that Dr. Gilliam has shared with us regarding the impact of teacher bias And if you have the opportunity, I encourage you to listen to his session later this afternoon. But we'll hear from him in his own words, talking a bit about what are those factors that really do contribute to teacher bias, and just a few examples of some of those exclusionary practices.
Hi, Future Hindsight listeners. One great way you can support our shocking
race of the teacher. And the reason
one of the founding practitioners of early educators' implicit biases regarding sex and race relate to behavior expectations and recommendations of preschool expulsions and suspensions. If you are skeptical about implicit bias and how it works in practice, this conversation might change your mind.
what we found that was a bit shocking was this, that the degree to which teachers were focusing more on Black children, especially Black boys, was about the same regardless of the race of the teacher. And the reason why is because the bias is implicit. It's not something that we're intending to do. It's something that we do because of our expectations. Our expectations that are shaped by the things that we see on television, the things that we hear in the news, all the things we see and all the things we hear and all the things we think we've seen and heard that tell us what to expect out of which child.
We talk about the prevalence of implicit bias in our teachers, the promise of universal pre-K in mitigating that bias, and having conversations about the problems we face as the first step to solving them. Let's listen in. Thank you for joining us.
My pleasure, Mila.
So you conducted a study to assess the potential role of preschool educators' implicit biases in disproportionate expulsion of Black boys. What prompted you to do this study?
We started this study back in 2002, 2003. And at the time, I was mostly interested in how state-funded preschool programs. As we were getting ready to do this big national study, I was also working at the Yale Child Studies Center, supervising child psychologists and psychiatrists and pediatricians who were working with young children, and couldn't help but notice that many young children who were under the age of 5 were referred to us because they had been kicked out of a preschool program or expelled from a childcare program. And so we thought, well, if we're going to be doing this national study anyway, why not weave in a few extra questions about expulsion and see what we find? And we were absolutely shocked to find that children were expelled from preschool programs, 3 and 4-year-old children, at a rate more than 3 times that of grades K through 12 combined. And when talking about childcare programs, the rate's about 13 times that of schools.
Okay, that's really shocking. What is the kind of behavior that gets you kicked out as a preschooler? Because I have to be honest, I have never heard of anybody being expelled in preschool.
It's crazy sounding, isn't it, to be kicked out of school before you even get to school? What we've found is that oftentimes it's for very simple things like not complying, not going along with rules. I've heard of children being expelled because of zero tolerance policies. A child who came to school with a water gun, and because the water gun looks like a gun, the child was expelled. I've heard of a child who was expelled from a childcare program that was associated with a school that came to the school with a backpack, and the backpack smelled a little funny, and the teachers opened up the backpack and found a bag of marijuana. And it turned out that the bag of marijuana belonged to mom's boyfriend, who was visited by the police the night before and needed to have a quick place to hide it. And then he forgot to get it back out. And so this child's crime was that he just went to school and took his backpack with him. I've heard of children expelled for running down the hallway in a way that makes the program and the administrators afraid that the child might get hurt. It can kind of run the gamut, but in many cases, the main reason that children are expelled at 3 and 4 years old often seems to be because they're acting like 3 or 4-year-old children.
All right. And so what is the biggest takeaway for me is really just what Dr. Gilliam just said. That idea that 3 and 4-year-old children are getting expelled for being just that, 3 and 4-year-old children. I appreciate hearing directly from Dr. Gilliam, just those examples, those very pointed examples of how those policies impact young children. As many of you are aware of the study, but I really wanted to just zoom in on some of those exclusionary practices and those ideas around young children and the behavior that contribute to these expulsion ideas. And so what we know and what is very clear from Dr. Gilliam's work is that expulsion is not a child behavior problem. It is an adult decision problem. And so with this knowledge, we have to consider, how do we support equity? How do we start to challenge where those disparities lie? And so Grace is going to help us shift and think about some approaches that move us in that direction.
Yeah, thanks, Lisa. So we start with understanding that bias lives within us. So we need to be asking ourselves, how do we best work with teachers to improve equity and efficacy? Well, we have to optimize the teacher consultative alliance. And so there's some ways that we can do that with a lot of intentionality. We are working on engaging early and often. So whenever we have the opportunity to connect with the childcare providers in our region, we have opportunity to connect and have that conversation, promote the understanding of infant mental health, early childhood mental health. We look for those access points, and we're engaging as early and often as we can in exploring the principles and ideas around infant mental health and equity. We also are addressing biases and stigma. So what does that mean? That means we have to get really good at having uncomfortable conversations and explore and practice with consultants, so that when we get into those conversations with teachers, that we are able to guide them through that internal exploration process and examine their own biases and stigma. We need to create the connections that make this all possible. So only through relationships can we have the type of alliance that we need to be able to explore these concepts and build a deeper understanding and a shared commitment to being a champion for a child who's being excluded from a program or is really suffering from the exclusionary practices that may be even within the policies of programs. We need to inspire shared beliefs. And I think that's in the title of our presentation, because it's something that we care a lot about in Ohio, is that this is guided, this work is really intended to be aspirational and inspirational. So we want to be able to inspire the field to be able to take the lead in doing this internal work, and to have it be really marching orders, so that our mission and our vision are aligned with our actions and our professional capacity building. We also want to be able to build capabilities. And so we're skill building. We know that empathy is a skill that needs built and strengthened like a muscle. And we're building capabilities for the teachers, for the early care professionals, for families. We're building skills for every adult that is in the life of that child that we come in contact with, because we want to build an understanding of social, emotional, behavioral skills that is just second nature to folks, so that they understand and they see the needs and the opportunities that exist. And that's kind of the role of that infant early childhood mental health consultant, to build the capabilities of the adults around that child. And then we, in order to be able to ask people to change and grow and to learn new things and try new things, we need to build confidence. So building the confidence of those teachers to try new things, building the confidence of our workforce to be able to come together and prioritize all of these things, and have the confidence to be able to lead a challenging conversation about internal growth that needs to happen. So how are we doing this? So we're doing this with a lot of intentionality, and it's leading to a process of changing things. So as we change, we are switching over from an old standard of care to a new standard of care. And again, this has statewide traction, and it's supported by some infrastructure investments that have been really critical. So we're moving away from having a limited ability to understand what children are telling us through their behavior to a newer standard of care where we're identifying, addressing the early signs of relationship and behavioral concerns to prevent the escalation to that behavior. We're moving away from perceiving children of color as being a problem or treating them differently from white children. And we want that to be absolutely a thing of the past. And we are celebrating and understanding that disparities and implicit biases that do exist are recognized and openly discussed, and that we're creating equitable solutions for young children, and that the children in communities are a part of that. They're the center of that solution and that problem solving. The old standard of care, it expelled children before, even before preschool, before kindergarten, without understanding what their needs were. And you can imagine the lack of opportunity and the disparities, the increase in disparities that this type of practice is promotes. And so we've moved away from that. And again, this is an aspirational goal to be able to give social emotional support to little ones where they learn and grow, so that they are ready for the educational journey that they're embarking on. And finally, so our old standard of care really identified mental health concerns for parents without having access to additional support. So we were really focused on what is wrong with the child. We really associated mental health issues with mental illness. And our new standard of care is to offer support and a reflective process to caregivers, preschool teachers, home visitors, and to families, parents, so that they have a deeper understanding and appreciation for mental health. We're really at the forefront of destigmatizing mental health and opening up access. So here is part of the point that we're making. Infant and early childhood mental health consultation is a service that builds capacity of the adults who care for young children. So we are capacity builders, and it is improving equity and inspiring change in innovative ways and improving access. What we would like to have happen in Ohio is for all children to have safe and enriching educational environments, and to not lose access to those educational opportunities. We'd like for this to be intervention and prevention focused so that we avoid having to use treatment as an intervention. And we would like for everyone to understand what infant early childhood mental health is all about. So this is part of the foundational issue, is that the real challenge is changing how adults see and respond to a child when they're in distress. And the trauma-informed care movement, the increased awareness, the stress of the pandemic, this has really raised this into the national consciousness, that how we see children in distress matters, how we respond to children in distress matters. And so part of our solution that we are working on is teaming through a crew. And this is the concept that we're going to talk about now. We want to offer safe and supportive opportunities to shift adult mindsets. And we know we need to do this in a way that encourages composure, positive intent, supportive, psychologically safe environments in which teams of adults can help support each other through the shifting of their mindset and their perspective. So what does this look like? Well, it absolutely has to happen in a collaborative and parallel process kind of way. So but by parallel process, we mean that the teaming needs to happen at the highest level. So we need cross-agency participation and buy-in at the state agency level. And that's what we have going on in Ohio. It's very exciting to have the commitment to the whole child and this concept that we need partnering around helping children be successful and have successful educational and life outcomes. We also need a multitude of provider agencies, and that includes faith-based folks and providers that might be non-traditional providers, all in the space and informing what we're doing so that our teams are comprehensive and that we're hearing all voices represented. That is absolutely key to decreasing disparities. We know that we need adequate staffing and supervision. So we have workforce issues. We're actively working on expanding and addressing them all the time. We know that reflective supervision and embedding reflective practice and all the things that come with that kind of teaming is absolutely critical. And so in the mental health field, we have guidance and recommendations around supervision. And we're also layering in group reflective supervision as a way to practice having those dynamic conversations about equity, about that challenge values and really encourage us to address issues around social justice and in a safe and supportive way during our routine reflective practice so that we can turn around and help those that are engaged in our infant early childhood mental health consultation with that practice as well. We also know that the families served need to have a voice and be at the center of the consultative work that we're doing and part of the teams and informing the process so that their needs are being met. We recognize that Ohio is an incredibly big and diverse with 88 counties. It is a big and diverse state covering a lot of geography. And we know that the families that we are serving vary, and that is one of our strengths. So we want to make sure that all families served have a voice in what those services look like, and that the local input is really valuable. So let's talk a little bit about what this CREW concept looks like. So CREW is an acronym, and it's an acronym that really guides our thinking and our way of being. So we have C, which is for connecting, and we know that caring relationships are central to all we do when we are forming teams in order to support children and programming. We know that these teams need to be reflective. We know that we need to be able to calmly, with composure, safely reflect and listen. So we're creating a space that is really intended to be able to be reflective. We know that empathy, as we discussed earlier, empathy is a skill that needs to build over time. So we're really focused on how do we provide spaces that allow us to build that skill of empathy and be able to maximize feeling and being well. What is this? I don't think this is anything that any of us take for granted now, having been through 2 years of a pandemic collectively, that we all have a newfound appreciation for what it means to feel and be well, and that this is part of what we need to be exploring and understanding and valuing, that not everyone has a shared understanding of what it means to feel and be well. We also want to encourage wondering. So this is a high order cognitive skill, prefrontal cortex. We want to be able to safely consider and be curious within our teaming process. So we want to have teams that allow for wondering. And we want to have teams where people feel safe enough not to have to censor and that they can share and explore. So to support a reflective teaming process, careful consideration of multiple perspectives is super important. So in order to begin exploring biases, then we really need to understand that this is absolutely critical, that we recognize that everyone on a team is going to have a different perspective. And if we think about Grayson again and call him to mind with his struggles in his preschool classroom, the director had called us, Mrs. Gray. She asked for the consultant to come because she felt like he was on a track to be expelled from the program. And she was very concerned. So we recognize that teachers, staff, administrators each have their own perspective. They have their own things that they are focusing on. And for Mrs. Gray, the program director, she was concerned that she would lose a teacher. So both of the teachers in the classroom had expressed that they weren't sure they would be able to stay if Grayson stayed. So we know that this is absolutely a factor. We also know that parents have a perspective. And in Grayson's case, his father was working hard to be the best parent that he could. He was actively doing the parenting himself because his wife was deployed. So she was in Afghanistan deployed, and he was back home taking care of a 7-year-old, Grayson, 4-year-old, and a 2-year-old with some developmental delays. So he was working hard to try to meet the needs of Grayson and feeling fairly frustrated that the center was not helping him. We know that the parents of the peers in Grayson's classroom were also definitely a part of this equation. They were voicing frustration and concerns because of the escalation in the behavior. And the last one on the list, the online reviews that came into play because they were giving feedback that online that maybe the center wasn't as high quality as they said they were. The other children in the classroom need to be considered. Grayson himself needs to be considered. What is he thinking and feeling? And this was an absolutely critical point in the teaming process when we were considering with multiple perspectives what Grayson might have been thinking and feeling. And that's the powerful part of this type of teaming when everyone involved starts to consider, what is this child experiencing? We needed input from community partners, so we reached out to the Air Force Base, and they have wonderful services that help support families that are experiencing deployment, and then also help support other community members that are impacted in helping support families that are experiencing deployment. And then, of course, all of our services are public services, and we are often funded by taxpayers. So what our stakeholders think about the services and how we're promoting and explaining and helping people understand our services is also incredibly important. Lisa, I'm going to invite you to add, if you would like to add any comments.
No, I think we're ready to dig into a little bit more with that crew, how to function a crew.
That sounds great. That sounds great. Okay. So let's talk a little bit more about how to create a crew. So I'm hoping that you're feeling curious about, like, how does this work and what does this look like? So where I'm going to go through the next 2 slides, we're going to talk about how to create a crew. So start with a clearly stated mission. So in our case, we want to prevent preschool expulsion. We're trying to stop the preschool to prison pipeline, and we want for every community member to be a champion for kids and maintain kids in programming so that they have every educational opportunity and they don't miss out and experience that disadvantage. We form a team and identify people with that shared vision, and we find champions and partners for the work. And then you set up crew structures. So being consistent and reliable in your meeting times so that everyone knows what to expect and that there's that shared understanding that we're going to come together to talk about this specific goal and vision. We are intentional and explicit about expectations and the purpose for each of the structures. And then we help each crew member understand their purpose, responsibility, role, and function as a member of the crew. So back to the perspectives. So we know that a teacher's goal and a teacher's purpose in helping support the child in the classroom is different from the administrators. It's different from the parents. And we will honor that and really expect that each person is going to understand their role and responsibility. We also embed the capacity building and shared learning opportunities into that teaming events. So when the team gets together, when the crew gets together, we're embedding the capacity building. And we optimize the crew approach by using national, state, and local resources to support our consultative workforce. So in the case of Grayson, this was an example where I relied on a team. So there were 3 of us that were working together to help support Grayson stabilizing and staying in this program. And we often do that as a part of our crew approach. We might have one person working on the programmatic intervention, someone focusing on family engagement and support, and someone focusing on the classroom-based interventions. So taking this crew approach allows us to work really effectively and streamline and intensify the efficacy of the consultative model. So engage the crew in a continuous improvement cycle, also to gauge the action steps and align the crew mission as it evolves. So it's going to change, the mission will change. For Grayson, once we identified the main issues, which was this little guy was heartbroken that his mom had left. And so he missed her tremendously. And the biggest trigger for him was laying down for a nap. He did not want to be touched or consoled. He was deeply sad. And so we built an understanding. We pulled in supports to be able to understand and support his emotional experience. And then the mission shifted once he was stabilized, and we were able to bring in some more training for the teacher and help that center director create a relationship and a supportive kind of alliance with the father.
All right, thank you, Grace. And so you can see how even as we start to think about Grayson and his family, we can see how the utilization of a great crew can really make a difference. We're going to get into talking a bit about the diversity-informed tenets for work with infants, children, and families. And it's so exciting to me because I've heard this in multiple workshops over the last couple of days, and really this has become a focus. This is an aspirational set of principles that I think that we can all use as a tool or avenue for making change. The tenets really do focus on the individual level, the organizational level, and as well as our systems of care. And so thinking about the lens that you hear these, you can hear them on multiple levels, and thinking of all the different hats that you wear personally and professionally. I'm not going to read all of them individually, but I do want to just draw your attention to number 1. And this begins, the tenets begin with a central assumption that we cannot do work in diversity, equity, and inclusion without beginning with ourselves. And so that I feel is the very key point of this set of tenets, and so a critical message that we've heard over the last couple of days. For me, when I think about the diversity-informed tenets, they really are a call to action. And so when I look at numbers 2, 3, 4, and 5, I think that they are a set of tools and strategies that really do create a call to action for all of us to think beyond our small communities, or think beyond ourselves and go beyond, thinking about those children beyond our own circle, championing children's rights globally, as it states, and thinking about how do we use our amounts of privilege in responsible ways. And so considering our place and space, and really how do we use that in our work with children and families? How do we reflect upon that experience for ourselves and use that in the places that we occupy? When we think about Grayson's family and honoring diverse family structures, We know that maybe programs are not accustomed to having the father as a primary caregiver, but when we look at the changing dynamics and experiences of families, we know that it is important to consider all of these family structures. As I have think about some of the programs I've worked with and experiences with parents, something as simple as having families bring in a family picture. This was a challenge for a parent that I talked to because the child lived between two homes, and the mom and the dad weren't able to provide just one solo family picture. And so that caused just distress in thinking about, how do I attempt to participate in what seems like a very wonderful activity and a way to really bring in families into the classroom, but knowing that sometimes families don't always, we unintentionally bridge those gaps and make those gaps with families. The second set of the tenants, we think about number 6, 7, 8, and 9. Those really are thinking about, how do we allocate our resources and our information? Understanding that communication, again, is critical, and thinking about how do we convey information to home and school regarding children and families? How do we communicate with each other as a part of the crew and the team? And realizing that there's a need for ongoing reflection on how programs and systems really do use their time, their money, and their support on ways to help support all families and create access for all families. And making sure that when we think about number 10, we're advancing policies that support all families. It's easy to be an advocate for, broad policies and procedures, but really be critical advocates. We're called to be critical advocates that really consider how these, the impact of policies and how these policies support certain families or many families, but how do we really think about how we can support those that don't impact some, but really do focus on all. We want to give you some closure to Grayson's story. So Grace is going to finish up with telling us what has happened with little Grayson and his story, and then give a couple of our local examples in Ohio.
Yeah, thanks, Lisa. So the happy ending for Grayson, you'll be happy to know that we were able to continue to support him on through his kindergarten transition and through the return of his mom from her deployment, and also helping support and recognize that his family was really struggling, and it went beyond Grayson and Grayson's needs in the classroom. We were able to help identify that the 2-year-old also needed to be connected with early intervention through our developmental disabilities programs in the region, and that the sister was also at risk. So the 7-year-old sister was bearing a lot of that responsibility too. And she needed additional support, which they were able to add into the after-school program. And that was after the center director, Ms. Gray, became a champion for this family. And those relationships, the relationship between the teacher and the father, the relationships between both teachers in the classroom and Grayson, and the relationship between the directors supporting the teachers, that was the profound and lasting impact. So that center continues to be a center that we can rely on to maintain children that might struggle or have an identified need. They are champions for maintaining kids. They are also really important in the transition on into school. And we know that this is an important aspect as well for how do we help kids stabilize into school. So Grayson now is in elementary school and he is thriving, and we have strengthened our community and family partnerships and learned so much from this situation, this story. And I would invite you to think about the Graysons in your life and think about how those present an opportunity for you to think about your programming in a different way and think about teaming opportunities. And I believe we have a couple more slides that are going to just drive home some really important points. I think Dr. Shriver mentioned that data was a portal, and I love that. Lisa and I are both big fans of data, and that data can inform us, that it's an active living thing. And we would encourage you to check out this resource in our work, our partnership with Ohio Department of Education to explore and expand early childhood mental health into the educational realm. We are using tools from the University of Maryland. And so we have a link here to their teaming tool, which is a perfect fit with consultative model. And so we use that and take a data-driven approach to how do we capture what's happening with teaming. And then the next slide, we also want to give a shout out to the process that we have going on in Ohio to recognize the whole child, and that the child is the center of what's happening. And in order to be able to meet the child's needs, we need the community partnerships to be strong and robust. It's not just on a single system. Often our educational partners are heavily leaned upon. So we are engaging, and we're encouraging every community to engage in a children's mental health team and have that be a really a mission-focused shared experience across systems, with early childhood mental health being one of those services that helps increase access and promote equity and inclusion. Lisa?
All right, I know we are approaching our time together today. I would like to just give a couple of moments, if we do have them, Crystal, to invite any closing comments or questions.
We are checking the chat right now. It seems like we had one question earlier that was answered. Brian, do you see any others? All the questions have been answered on our end.
All right, fantastic. Well, we would like to thank everyone for joining us this afternoon. We are so excited to be able to share some information with you, and hopefully you find it valuable in understanding how you can use in a team approach, using that crew mentality when bringing together multiple disciplines to really help support children like Grayson.
Yeah, thank you all for your time and attention to this. I think I'm going to use Travis Spencer's words. We are protected, we are safe, we are loved, and we're going to add, we are empowered to be equity and inclusion champions.